The outstanding story of Emily of USA, Aarti Goswami of Asansol, and Mrs. Khan of Bhawanipur. When a disease sincerely deceives even the doctor, medical failure begins. By listening to today's 3 case studies, you might change someone's future one day. To protect patients' confidentiality, the real names of the characters have been changed, but the events are as authentic as they are sensational. These are 3 remarkable stories when ovarian problems presented with completely unexpected symptoms. The thrill of skiing on the Swiss Alps is dramatic. Yet, skiing was never part of Winter Olympics until 1936, after much lobbying by a doctor. This doctor, with a striking personality, was initially a gynecologist and later became an eye specialist. Born in Germany, he moved to Switzerland after retirement and became a skilled skier. Before retiring, he made a significant contribution to medical science with a strange discovery. His name was Frederick Ernst Krukenberg. Krukenberg taught us that ovarian tumors do not always originate from the ovary. Occult or hidden lower abdominal tumors can originate from the throat, lungs, or even from the breasts. While a patient might think that a tumor in the lower abdomen is an ovarian tumor, she may not realize that the actual problem lies in a completely different organ. Such tumors are still named after him, Krukenberg Tumours. Today's 3rd case is about Mrs. Khan, who had an ovarian tumor, but the actual problem was hiding in her colon, that means a Krukenberg tumor. But before that story, let's discuss the other 2 stories. First, Emily's case and then Mrs. Goswami's case. Not only can problems in other organs present in ovarian tumors, but ovarian problems can also disguise themselves as symptoms of other organs, deceiving both the patients and the doctor. Breathing problems, high blood pressure, and gas are some examples. Who would think of ovarian problems first? But the time has come to be aware. We have many examples of such stories. First is Emily's Christmas. It was December 2021, just a week before Christmas. Emily was about to turn 15 in a few days and wanted to celebrate her birthday in Atlantic City. Preparations were in full swing. Like other children of her age, Emily used to go to the gym. But that day, while picking up a ball, she felt severe pain in her chest and arm. While eating lunch, the pain subsided a little, but the discomfort remained. Her friends insisted that she visit the nurse. The nurse was surprised to find Emily's blood pressure impossibly high and her heart racing at a dangerous speed. Her pulse rate was skyrocketing. Emily was taken to Riverview Medical Center, but initially they found no obvious cause for her high blood pressure and pulse rate. She was referred to Children's Hospital. At Children's Hospital, various specialists began systematically examine Emily. The cause of such high blood pressure at a young age is often hidden in the kidneys. While performing a kidney scan, the doctors noticed a large tumor hidden in her abdomen. Emily was unaware of this tumor. The gynecologist prepared Emily for surgery. Her blood pressure was lowered with medication before the operation to prevent a stroke during surgery, which in itself is not without risks. There are many risks associated with quick lowering of blood pressure. The surgery began and large ovarian tumor weighing about 4 kg was removed. Hidden behind it was a second tumor of the size of a small football. The blood supply to her kidney was about to stop due to tumor's pressure, causing her blood pressure to rise. It was most surprising. After operation, Emily recovered and went home. Initially, everyone thought the tumor might be cancerous, but the final biopsy report revealed it was not. This type of tumor was hidden in Emily's ovary, and she had no idea. The human abdomen is a vast space. Especially in women, the ovary can manifest insidiously in the abdomen, which can be a huge surprise to the common person. This issue is worth considering. The ovary is a gynecological organ, but a woman with ovarian problem would certainly expect to have some sort of gynecological symptom. But here is the catch. Ovarian problems often present with non-gynecological symptoms. So, if you have unusual problems, at least get an abdominal ultrasound. Emily's story from America was covered by media around the whole world. However, the case of Aarti Goswami from Asansol did not make any headlines. Aarti Goswami, age 65, lived in Asansol, a town in West Bengal. I saw her in my clinic soon after I returned from England. Her granddaughter had forcibly brought her to my clinic. I heard that she had been undergoing treatments for asthma for a year and a half. She had been using an inhaler prescribed by a local shop for over a year. That year, all the grandchildren came for puja celebrations a few days before Mahalaya. Her granddaughter, who was doing an MSc in geography from the University of Delhi, has a tendency to read complicated texts on health. She was concerned about her grandmother's health. The granddaughter was confused, thinking it could not be asthma. After a brief examination, it was found that the water has accumulated in her chest and abdomen. Additionally, an ovarian tumor larger than football was hidden in her abdomen. Just 2 days before puja, her granddaughter and son brought Aarti Devi to our clinic. Tests revealed it was a type of ovarian cancer. At that moment, her physical condition was such that an operation was not possible. The disease was controlled with medication and the surgery was performed after 2.5 months. 4 days after surgery, Grandma cut the Christmas cake with us while she was still in the hospital. She then went back to Asansol, and it's been 6 years now. She has been fine. But who would think that an ovarian tumor could cause asthma or breathing problem? As I mentioned, the ovary can be deceptive. It does not lack guile. I hear regular stories where ovarian problems presented the symptoms of other organs problems, such as gas issues, constipation, or constant abdominal bloating. Appetite decreases sharply and patients start to reject protein in diet. If you look at a little deeper, you can see that in some cases it is the ovary causing the problem. A large number of women discover after a long time treatment for gas problems that it was not gas at all. Those were actually manifestation of ovarian problems. Next is a third incident where other organs problems presented as an ovarian problems. Yes, the story of Krukenberg tumor. In other words, tumor from other parts of the body can appear as large ovarian tumor. Medically, this is called Krukenberg tumor. We see quite a number of women in our practice whose attention has been captured by a newly discovered large ovarian tumor. The family seeks treatment for the ovarian tumor, but a closer look reveals that the true origin of a giant ovarian cyst or tumor is somewhere else. The real origin has been overlooked. The culprit could be hidden in the thyroid, breast, lung, gallbladder, or even at colon. That is why all the blood tests and scans done according to international norms when an ovarian tumor is diagnosed are to find out if there are any other problems in other parts of the body. When you are fresh MBBS graduates and even as young doctors studying gynecology, we had the misconception that ovarian tumor scan was meant to look at only at the ovary. But today, after spending so many decades in this field, I have learned that examining the ovaries as well as the organs outside the ovary is crucial. However, trap can be there too. Sometimes ovarian problems can even fool CT, MRI, or even PET-CT scans. Today's video research would not be complete without sharing one more interesting story. Mrs. Khan, a newly retired, strong, independent lady. She studied from a reputed school in Kolkata and is also very successful in her professional life. Her son, daughter, and grandsons are all so soft-spoken and possesses enormous patience. Sometimes I feel like, as a doctor, I learn from them how to treat people with such kindness. I often wonder where they learned to have such humble nature. I still remember that year a few days after New Year's, Mrs. Khan needed an emergency operation for an ovarian tumor. The pain and pressure from the growing ovarian tumor was so intense that there was no time for additional tests before her surgery. We proceeded with MRI, CT, PET scan, and all the necessary blood tests. Even after the abdominal tumor was surgically removed, we suspected the battle was not yet over. Was there something hidden? We searched every inch of the abdomen. Why? Because of high suspicion. We searched over an hour. Didn't want it to give up. There was nothing unusual in the abdomen, but at the end of the examination, we found a small hard spot at the colon. Given the strong suspicion, we immediately operated on the colon as well and discovered that along with the ovary, the colon also needed treatment. Both surgeries were completed on the same day. After taking medications for a few weeks, she is now fine. Such tumors are called Krukenberg tumor. Professor Frederick Ernst Krukenberg, an expert skier, was a professor at University of Bonn in Germany. He was the first to bring to the world the research that not all ovarian tumors originate in the ovary. It is also necessary to consider whether they are expressions of other organs problems in disguise. Although this story may sound unusual, the treatment for patients with Krukenberg tumors is quite challenging, requiring many extra tests and treatment. Unfortunately, many patients lose patience halfway through the process and need to be persuaded again. It is critical to have an inquisitive mind. The day Krukenberg's tumor is diagnosed, the job of Sherlock Holmes is over. From that day, all future treatment can be well arranged according to international guidelines. However, before that, even experienced doctors and patients can be fooled by this insidious ovarian tumor. So, if any persistent problem in a woman's abdomen or chest keep recurring, don't forget to just at least get an ultrasound of the abdomen. Of course, in all cases, ovary will not be the main culprit, but some of the results of the investigations may surprise you. What's the harm in being careful? So, if any persistent problems in a woman's abdomen or chest keep recurring, don't forget to at least get an ultrasound scan of the abdomen. Of course, in all cases, ovary will not be the culprit, but some results of investigation may surprise you. What's the harm in being careful? That's all today. See you soon over another video research.